Hearing loss can be connected to a whole raft of health problems. Another reason to get your hearing checked. And Rob Hamilton from Hearing Well Matters joins us with more. And is it kind of a cause and effect? Like is sometimes hearing loss a symptom of another health condition, or can it cause other health conditions?
Well, hearing loss has been implicated in our brain health. And so we know that when patients suffer hearing loss that goes untreated, it can definitely affect their brain health in things like cognitive decline, dementia. It can also affect falls and your balance, and finally also just how you interact with others in terms of depression, fatigue, anxiety, and those types of things.
Because a lot of that depression and anxiety may come from, okay, I'm not going to go out because I can't hear anything when I go there, or it really bothers me when I go. So you stay inside, you're not getting that social interaction, which is so important to our health.
Very much so, yeah. So, getting tested for hearing loss is a good thing. They say 50 years, test your ears. So if you're over 50, you should really think about getting your hearing tested annually.
Right, because wearing a hearing aid or having any kind of hearing device, it's not the stigma that it used to be, right? It's like wearing glasses or contact lenses. It's going to help you.
For sure. The average age of being tested and fit with hearing devices used to be in the 70s, and today it's fallen almost by 10 years. So early 60s is the average age now for being fit with hearing devices, and there's not nearly the stigma that there used to be.
And it's not because the noise is that much worse. It's just people are realizing this is a really neat thing that I need, especially after you've had one, right? Is it like putting on glasses and, I can see? It's like, I can hear.
Yeah, the manufacturers have really worked hard at making the hearing aids comfortable to wear, very functional. They're excellent when you go out into noise, like at a restaurant. You can hear your dinner companions much better, and so they're much easier to wear than they used to be.
Okay. Do you need a prescription or a doctor's referral to get your hearing tested?
No. We do work closely with the family physicians and with ear, nose, and throat physicians, but in terms of getting tested, you can do that at a hearing clinic.
Okay. And then what about a cost? Is that covered by OHIP, or is there a fee for getting a hearing test?
There's no fees at our clinic for getting hearing tested, and so there's really no barrier that way to getting the hearing tested.
Okay. And then what about for hearing aids or hearing devices? Is a lot of that covered through health plans, or in some cases through the province?
Right. So it's a combination of sources. So first of all, the province of Ontario does make some funding available, usually about $500 per side or $1,000 for a pair of hearing devices. Also, private insurance will often cover a portion. And then there are other agencies like Workmen's Comp or Veterans Affairs, ODSP, or non-insured health benefits that all also cover hearing aids.
Okay. And then once you've got tested and maybe fitted with a device, or maybe not, maybe you passed, how often should you get tested?
Usually annually when you're over 50 is a good call. If you're younger than that, maybe getting tested every 3 years makes good sense.
Okay, and you were saying that sometimes it's the people around you that will tell you that you need to get your hearing tested, right?
Very much so. We take our hearing for granted, and we don't really remember how well we used to hear when we were younger. And so it's often family members who are the first to identify that there's a hearing loss. And so, listening to them and listening to our loved ones is really important.
Right, because they're the ones that will, notice that you've missed parts of conversations, or that you've got the TV or your stereo on too loud.
Very much so.
Okay. So whereabouts are your Hearing Matters clinics open?
So we have a single clinic in central Burlington.
Okay.
We opened in 2009, so it's a state-of-the-art clinic. We have 2 testing suites, so it's ideal for husbands and wives to come in together and get tested. We have a really nice approach there, with very passionate about hearing healthcare. We have over 185 Google 5-star reviews.
Okay.
So our patients have really responded since we opened in 2009.
Okay, Rob, thanks very much for coming in. We'll get the links up on our website, chch.com/morninglive.